Welcome to this podcast on desmoplastic melanoma. This is often a difficult diagnosis to make clinically. And the reason for this is that desmoplastic melanoma often has a banal clinical appearance, and many times it will be amelanotic. It can also present as a subcutaneous firmness without any pigment changes. The differential diagnosis for such lesions often does not include melanoma. The differential diagnosis includes entities such as cyst, dermatofibroma, lentigo, neurofibroma, and scar, and in only 33% of cases will the diagnosis of melanoma enter the differential. The potential ways to help diagnose desmoplastic melanoma include being observant of some clinical clues. Any banal appearing lesion on chronically sun-damaged skin that is symptomatic, is growing, or presents and is as an unexplained scar with no prior history of trauma or a procedure would be concerning for desmoplastic melanoma. In addition, lentigo maligna melanoma that on palpation has a firm area within it would be suspicious also for desmoplastic melanoma. The dermoscopic clues include the presence of irregular blood vessels within such lesions. Here's a patient who presented with a scar-like lesion on his central chest with no history of trauma to the site. On dermoscopy, the lesion revealed serpentine vessels and corkscrew vessels, and on biopsy, this proved to be a desmoplastic melanoma 5.6 millimeters in thickness. Here's another patient who has a pigmented lesion on the forehead. On dermoscopy, the lesion has features of lentigo maligna with circle within a circle feature. On palpation, the lesion had a firmness on the inferior pole just below the scale bar present on this image. Within this area of firmness, there was a presence of a cluster of serpentine vessels, and on biopsy this proved to be a lentigo maligna melanoma with a desmoplastic melanoma component. Another patient presented with a tan patch on her arm. However, on the superior pole of this tan patch was a bluish nodule that was firm on palpation. On dermoscopy, the tan area revealed tan structureless pigmentation, and the firm area had a blue-white veil and some crystalline structures when viewed with polarized light. On biopsy, this proved to be a lentigo maligna melanoma in association with desmoplastic melanoma. The dermoscopic clues to the diagnosis of desmoplastic melanoma include, as previously mentioned, the presence of atypical blood vessels. In addition, the presence of regression structures or a negative network in such lesions would also be concerning features. Here are two desmoplastic melanomas. On the top is a cystic lesion that has dotted and serpentine vessels and is firm on palpation and is present on chronically sun-damaged skin, and this proved to be desmoplastic melanoma. The inferior lesion also presented as a firm nodule, and on dermoscopy reveals a negative network pattern, and this too was a desmoplastic melanoma. Here are two more desmoplastic melanomas. On the top is a desmoplastic melanoma with regression structures, and on the bottom is a scar-like lesion with a few dotted vessels as the only clue that this is a desmoplastic melanoma. For a full review of the clinical and dermoscopic features of desmoplastic melanoma, I refer you to this review paper in the Journal of the American Academy of Dermatology. I hope you found this podcast informative, and I thank you for your attention.